Destigmatizing hearing loss. That's our topic today on Ask the Hearing Doctors. Hi, I'm Jim Cuddy, and this is Ask the Hearing Doctors, and I'm joined today by Dr. Anna Anzola, Doctor of Audiology with Hearing Doctors, the Washington, D.C. area's highest-rated audiology practice with over 1,500 five-star reviews. Anna, as always, great to see you.
Great to see you, too.
So why do so many people refuse to acknowledge hearing loss?
Yeah, so that's a good one. There's a personal bias. There's big stigma. Vanity plays a big role. They're too expensive, perhaps some people would say. They don't know where to go. And we've said in the past, it's a very slow and insidious process. So you don't know what you don't know. You missed it. You ask for the repetition. So you implement compensatory strategies, right? You ask for the repetition. You're asking everybody else to be your hearing aid. And so there are ways of getting by. It's never you, right?
Of course not.
Of course it's
never me.
It's always somebody else's fault. Or, it was their voice, they didn't speak up, or they're mumblers.
Oh, I've gotten that plenty of times.
Right.
Plenty of times. Let's talk about, and I think this will surprise some people, just how common hearing loss is. And if you would, I think we should break it down between children, young adults, maybe even professions such as military.
Yes, of course. So, babies, okay? 2 to 3 babies are born in the U.S. out of 1,000 with a hearing loss by definition. Babies, right? Wow. Then you're talking about maybe 1 in 8 teenagers having a hearing loss. And when you get to be an adult, it's 1 in 5 between the age of 20 and 65. Military, we talk about, so they're coming out with tinnitus and or hearing loss.
Now, when we're talking about the little ones, the babies, and even some of the younger kids, younger adults, in many of the cases, is that just maybe something from birth versus something that happened in life, whereas an adult, it might be because you listened to loud music for a long time, or in the case of military, obviously, you've perhaps been out in the field and been subjected to lots of noise.
Exactly. And don't forget the millennials, right? So we talk about the millennials. So we're seeing more and more younger kids or young adults coming with a premature hearing loss, particularly exposed to loud levels of noise. So everything's going into the ears today. And what are we doing? We're cranking it up. And so loud exposure, premature exposure to the hair cells that we have in our ears are causing tremendous damage. So it's not just treating the hearing loss, but educating the communities about protection, hearing protection.
Absolutely. Protection's obviously the way to go if you have the knowledge to do it, if you've been told and understand it. But let's talk more about the stigma. What perpetuates this stigma? What keeps this thing going?
You know what? We're humans, right? So what do? We're wonderful, intelligent creatures. And what do? We have coping mechanisms, and we put those in place. Remember, it's not me, it's you. Repeat what you just said. You're asking for the TV to be put up a little louder. So we have strategies, and that's how we are able to get by. But anybody over the age of 50 should have their hearing tested. Vanity plays a big role. I don't want to look old. But if you don't treat it, you are going to look old. And there's no shame in hearing. We have invisible, tiny little hearing aids today that can do a wonderful job. And there's so much high tech. The other thing that comes to mind would be the fact that if you're not as savvy, people think that, I need to be very high-tech to wear those high-tech hearing devices, and that's not true. The reality is that, there's no shame in hearing, right? And hearing is sexy, because if you're wanting to engage with me and vice versa, we want to be able to have that open communication.
Right, and I don't want to have to keep asking you to repeat everything over and over and over again.
That's not sexy.
No, not at all.
That's annoying, and I'm going to walk out.
The next thing I know, you're gone. Right, absolutely. How do we diminish the stigma of hearing loss?
Good question. And I think what we're doing right now, educating the communities, doing this podcast, if you think about it, even the marketing that we do is always geared towards that older adult. Well, guess what? My youngest patient's 5 years old, right? And it's the whole life, it's communication for life. So I think that we need to change the way that we promoting hearing protection, promoting early examinations. So if there is a hearing loss to attend, the sooner the better.
Well, we've talked about this too before, where you could have a an infection, an ear infection, and if it's not taken care of properly, then all of a sudden you have permanent damage.
Right.
Just like with anything else in life, if you take care of it sooner, the better off you're going to be.
We take our hearing for granted. We think it's always going to be there, but the reality is that I know you take care of your eyes and your teeth, but your hearing and your ears are very precious. So early attention, identification, and early treatment.
Okay. Anna, thank you so much.
Thank you so much.
If you're in the Washington metropolitan area and you'd like to schedule an appointment with hearing doctors, click the link in the description or visit hearingdoctors.com.